Prochlorperazine Complete Drug Monograph. Stummer 1. Generic name, drug class, brand name. Generic name, Prochlorperazine. Drug class, antiemetic, antipsychotic, phenothiazine derivative, dopamine D2 receptor antagonist. Common brand names, Compazine, Stimidal, Bacastum. Number 2. Definition: Prochlorperazine is a phenothiazine derivative primarily used to control severe nausea and vomiting. It also has antipsychotic properties and can be used for schizophrenia, psychotic disorders, and anxiety. It works by blocking dopamine receptors in the brain, especially in the chemoreceptor trigger zone, CTZ, responsible for vomiting. Number 3. Mechanism of action, pharmacodynamics. Dopamine D2 receptor antagonist in the CTZ prevents stimulation of the vomiting center. Central dopamine blockade in mesolimbic pathways, antipsychotic effect. Anticholinergic and antihistaminic activity contributes to anti-nausea, sedative, and calming properties. Extrapyramidal side effects, EPS, due to dopamine blockade in nigrostriatal pathways. Endocrine effects, increases prolactin secretion, galactorrhea, menstrual irregularities. Uses, therapeutic applications, control of severe nausea and vomiting, postoperative, drug-induced, migraine-related gastroenteritis, management of schizophrenia and other psychotic disorders, short-term treatment of non-psychotic anxiety when benzodiazepines are not suitable, off-label, vertigo, migraine-associated nausea, cyclic vomiting syndrome. Narrative 5, indications. Severe nausea and vomiting, uncontrolled by standard antiemetics. Schizophrenia, acute and chronic. Non-psychotic anxiety, short-term only, max 12 weeks. Control of agitation and behavioral disturbances in psychosis. Number 6, contraindications. Known hypersensitivity to prochlorperazine or phenothiazines. Coma or CNS depression due to alcohol, sedatives, or narcotics. Children 2 years or 9 kilograms high risk of respiratory depression. Severe liver impairment, bone marrow suppression or blood dyscrasias, narrow angle glaucoma, severe cardiovascular disorders, risk of arrhythmia. Number 7, before taking this medicine, precautions. Inform doctor if you have cardiac conditions, QT prolongation, arrhythmias, hypertension, liver, kidney impairment, seizures, lower seizure threshold, respiratory disorders, asthma, COPD, sleep apnea, Parkinson's disease worsens symptoms, blood disorders, history of agranulocytosis, leukopenia, pregnancy, use only if necessary, breastfeeding, avoid, excreted in milk, elderly, increased risk of sedation, falls, and tardive dyskinesia, avoid alcohol and CNS depressants. 8. How to use, oral tablets, swallow with water, with or without food, taking with food reduces stomach upset, buccal tablets, Bacastum, place between gum and cheek, allow to dissolve slowly. Suppository, insert rectally, especially if vomiting prevents oral use. Injection IMIV, only given under medical supervision in hospitals. Do not stop abruptly if using for long-term psychiatric conditions, risk of withdrawal and rebound symptoms. Now 9 dosing information. Adults, nausea and vomiting, oral. 5 to 10 milligrams, 3 to 4 times daily, max 40 milligrams per day. Suppository, 25 milligrams twice daily. IMIV, 5 to 10 milligrams every 3-4 hours, max 40 milligrams day. Schizophrenia psychosis. Start 5 to 10 milligrams orally 3 to 4 times daily. Maintenance 15 to 60 milligrams per day in divided doses. Severe cases up to 100 milligrams per day. Non-psychotic anxiety short-term use only. 5 to 10 milligrams orally 3 to 4 times daily. Max 20 milligrams per day. Children 2 years 9 kilograms. Nausea, vomiting 0.25 milligram kilogram every 4 to 6 hours. Max 10 milligrams per day. 10. Misdose, overdose. Misdose, take as soon as remembered unless near next dose. Do not double. Overdose symptoms, severe drowsiness or coma, uncontrolled muscle spasms, seizures, severe hypotension, irregular heartbeat, QT prolongation, respiratory depression. Management, supportive treatment, airway protection, activated charcoal, treat arrhythmias, benzodiazepines for seizures. No specific antidote. Number 11, stop or avoid taking. If allergic reaction, rash, itching, swelling, difficulty breathing, signs of neuroleptic malignant syndrome, NMS, high fever, muscle rigidity, confusion, unstable BP, uncontrolled involuntary muscle movements, tardive dyskinesia, severe jaundice, liver toxicity, agranulocytosis, fever, sore throat infections. Number 12, side effects. Common, drowsiness, dizziness, fatigue, blurred vision, dry mouth, constipation, urinary retention, weight gain, photosensitivity, sunburn risk. Serious, extrapyramidal symptoms, EPS, tremor, rigidity, dystonia, akathisia. Tardive dyskinesia, TD, involuntary repetitive facial tongue movements. Neuroleptic malignant syndrome, NMS, rare but life-threatening. Agranulocytosis, low WBC, risk of infection. Seizures, liver toxicity, cholestatic jaundice. Prolonged QT, arrhythmias, sudden cardiac death. Number 13. Vital information, key nursing points. Use lowest effective dose for shortest duration. Monitor vital signs, ECG, liver function, CBC regularly. Warn patient about drowsiness, dizziness, avoid driving. Avoid alcohol, sedatives, antihistamines. Protect skin from sun exposure, photosensitivity. Educate about EPS and tardive dyskinesia symptoms. Gradual withdrawal for long-term users. 14. Drug interactions, other drugs that affect prochlorperazine. CNS depressants, alcohol, opioids, benzodiazepines, antihistamines, sleeping pills. Sedation, respiratory depression. Anticholinergics, atropine, antihistamines, TCAs, worsen dry mouth, constipation, urinary retention. Levodopa, dopamine agonists, antagonized, reduced effect. Antiarrhythmics, antibiotics, macrolides, quinolones, antidepressants, risk of QT prolongation. Warfarin, altered anticoagulant effect, monitor INR. Lithium, risk of neurotoxicity. Diuretics, thiazides, loop diuretics. Hypotension. Thank you. Have a nice day.